Ho, ho, ho! Merry Christmas to one and all. Where are you? Oh, there you are. I've got to go and feed the reindeer in a minute, but there's just time for a mince pie and a quick quiz to help you work up that Christmas appetite. Christmas pudding. There's a maximum score here on offer, and the questions and a number of points available for each question in the bracket. There's a 5-second countdown timer to warn you when the picture is a-changing. Use that video pause button for more time. I'm going to give you 4 of my patients for you to diagnose. This quiz is rated easy because it's Christmas. Let the games begin! Oh, ready for some answers already then? Well, here's my answers. Ho, ho, ho!
The 3 dermoscopic signs you should have noticed are a well-demarcated edge, milia, or stars in the night sky pattern, and multiple comedone-like openings. If you said crypts, I'll accept that, but I think they need to be larger to be truly crypts. I can't see any blood vessels. Which side is polarised light? The left side, because milia show up better on non-polarised contact dermoscopy, being in the epidermis and therefore more superficial. Diagnosis? This is an acanthotic seborrheic keratosis. I'll accept plain forward seborrheic keratosis, but it's a good habit to get into to distinguish the different patterns of seborrheic keratoses. The dermoscopic signs you should have noticed were the white-yellow popcorn pattern, swelling of the sebaceous glands, alongside short vessels in between the glands. If enough of these, you would have what's called a crown of thorns pattern, but perhaps not here. What's important is that these fine vessels don't travel across the centre, which is more common in BCCs. I couldn't see a clear infundibulum showing the location of the associated hair follicle, but that's not uncommon. Being on the face, don't let these larger, slightly out of focus dermal vessels put you off. The face has a flat basement membrane and is thinner, so the dermal vessels are often prominent, especially on sun-damaged skin such as this. This is sebaceous gland hyperplasia. And if you didn't get those answers, then you might want to watch this video here. 5 points on offer here for this lady with a firm papule or nodule by her eye. The signs you should have noticed were the clearly focused arborizing vessels. Note how a large trunk vessel becomes a branch, becomes a fine twig. The other signs are some subtle shiny white structures flashing up on polarized light, and then some scale here suggesting an underlying erosion. In combination with the clinical history and picture, this is a nodular BCC. If for management you put refer to secondary care, this is not enough for a point. This is a very high risk location being near the eye and should be treated as soon as possible. A 2-week cancer care pathway referral is most appropriate here. Routine referral is not enough. As it was, I sent her actually directly to the plastic surgeons because I know from experience my local dermatologist will not perform surgery here, being in the tricky location. If you're unclear on the dermoscopic signs of BCCs, then this is definitely the next video you need to watch. And finally, this slowly growing pink nodule on a lady's arm in her 30s. It was firm to touch, and clinically I wondered if it was a nodular BCC. However, as soon as I saw the dermoscopy, I was reassured. Note the hairpin vessels throughout, with a nice white halo of keratin around them. This is a keratinosis skin lesion. Other signs you should note are the yellow keratin scale here, a few dark hemorrhages, and finally, if you want to watch the video, a milia flashing on and off. This is another seborrheic keratosis, probably acanthotic, but very pink. Without my dermoscope, I would have been considering a referral to find out what this pink nodule was. As it was, she was happy to just be reassured it wasn't cancer. And if you didn't get those answers, then you might want to watch this video here.
How did you do? If you got less than 10, here's a fork to go muck out the reindeer for me. There's a good chat. Failing that, watch a few more videos to boost your learning in the new year. Score 11 to 14? You seem to know something. Perhaps you are a primary care dermoscopist in the making. Keep going! If you scored over 15, are you looking to take my job? Clearly, I need to make the next quiz harder for you. Merry Christmas and a Happy New Year to all my viewers. And even if you're not a viewer, you are now.
Training a primary care dermoscopist for every general practice.